Hello friends, welcome to Eye Insider Ophthalmology Simplified. So in today's class we will discuss about the dry eye diagnostics. This is a very important class, so please don't miss and do subscribe for such informational videos. So we'll discuss the test objectives, the traditional and the emerging tests. So coming to the objectives, that is the symptoms of dry eye, we have traditional tests like questionnaires, that is OSD and speed questionnaires, and the emerging tests include measurement of functional visual acuity like NEI, McMonnies and IDAL by Alcon. Then we have this tear secretion or volume, so this which is measured with the help of Schirmers test. So it is done with the help of 35 into 5 mm Wattman 41 filter paper. So this paper is placed at the junction of medial 2/3 and lateral 1/3 of the lower eyelid and is checked after 5 minutes. So after 5 minutes when we check, so in Schirmers test 1, normal is more than 10 millimeters of wetting. In test 2, we also perform a nasal stimulation. And in test 3, there is retinal stimulation. So these are obsolete now. The commonly performed is test 1. So this measures both basal secretion as well as reflex secretions, the Schirmers test, because we are not applying any anesthetic. Whereas in Jones basal tear secretion, we apply anesthetic and then check the Schirmers paper. Okay. So here it only measures basal tear secretion in Jones test. So that is after anesthetic, right? Then we have another test, that is phenol red thread test. So in this test, a pH indicator is used. So the thread has the indicator which turns from yellow color into bright red or orange color when it comes in contact with the tears. So normal wetting is 9 to 18 mm. So this is checked after 15 seconds. Volume. Now coming to how to measure the volume of the tears secreted. So traditionally we do it under the slit lamp to measure tear meniscus height. Normally is 0.1 to 0.3 millimeters. And the recent ones include measuring it with the help of ASOCT, fluorophotometry. So these are the newer tests which can be performed. And we also have strip meniscometry to measure tear meniscus height. Now coming to the composition of the tear film. So the most important is the osmolarity, the cutoff of which is taken as 308 milliosmoles per liter or less. Okay, the normal is this. Then coming to how to measure osmolarity. So it can be with the help of either freezing point depression method or vapor pressure method or electrical impedance. Okay, so commonly used is the freezing point depression method. So electrical impedance is used with the instrument called Ipen. So this is the recent advance, and there is also the Tearlab test which also measures the osmolarity. Okay, so this are the regarding osmolarity. Then another thing in the composition is the biomarkers. So this matrix metalloprotease 9 and lysozyme are also measured in the tear. Okay, now coming to the tear film stability. So these are the classical example, that is the TBUT, tear film breakup time. So the invasive TBUT is done in which we use the fluorescin dye. So it is called invasive because we are using fluorescin dye, something we are putting inside the eye. And after that, we'll ask the patient to blink and we'll measure the time to develop dry spot. And there is no anesthetic applied. So we usually repeat it for 3 times to take an average reading. Okay, so more than 10 seconds is the normal, and if it is less than 5 seconds, it is diagnostic of dry eye. In non-invasive TBUT, we do not use fluorescent dye. Then how do we measure it? So it is with the help of a xeroscope, Keeler telescope, or Placido based video Placido based systems. And we also have the TFS analysis system. So this TFS analysis system, it takes topography images for 10 seconds for every second. Okay, so every second we will have the image. So in 10 seconds we will get to know whether there is a dry spot formed or not. In that way we find out the TBUT. Then coming to tear clearance. So it is measured traditionally with fluorescin clearance test. In this test we put 1 drop of 0.5% proparacaine, that is the anesthetic which is used. So after the anesthetic we will apply fluorescin dye or the fluorescin strip. Then we will perform Schirmers for 1 minute. After 10 minutes, after 20 minutes and after 30 minutes, we will see if the fluorescin is present or not. So normally after 20 minutes there will not be any dye. Then we have this tear function index. So in this also we apply the anesthetic and then fluorescin, then Schirmers. But the difference is that the fluorescin here is 10 drops of 0.5% fluorescin, that is of higher concentration. Okay. So in that way the intensity of dye stain is checked after 5 minutes. So this is a modified Schirmers, both fluorescin clearance test and the tear function index. These both are regarding tear clearance. In TBUT fluorescin clearance test we use fluorescin strip, whereas in TBUT we do not use anesthetic. In fluorescin clearance test we use anesthetic. Next, coming to assessment of the ocular surface. So in this we have diagnostic dye stainings. So we have various dyes which stain the cornea, conjunctiva and the ocular surface. and the recent methods include confocal microscopy. So the dyes used include fluorescin dye. So this fluorescin dye, it stains the cell membrane disrupted cells. So it gets stained when the cell membrane is disrupted. And in rose bengal dye, it stains the devitalized epithelium but not mucin. So if there is normal epithelium and there is no mucin, then also rose bengal will stain. Lissamine green also, it will stain the similar like rose bengal, but it does not cause stinging, which is seen with rose bengal, and it does not stain the conjunctiva, whereas the rose bengal, it stains the conjunctiva. So the staining pattern is almost similar, except that it differs in conjunctiva, but the Lissamine green has no stinging sensation. So there were methods which were used, like Van Westerwald staining system and the Oxford scheme of staining. So in this, they measure what areas were stained in the cornea and the conjunctiva. For the Oxford scheme, you can use any of these dyes. And in the Van Westerwald staining, we use rose bengal dye, the arrow pointing. Whereas in NEI workshop, fluorescin is used for the cornea and rose bengal is used for the conjunctiva. And as I said, Oxford scheme can use any of this stain. Next, coming to the measurement of corneal sensitivity. So traditionally, as we routinely perform it with the help of cotton wisp test, and the recent advances include the esthesiometry. So we have cocked bonus esthesiometer, and the other latest ones are also there. So this is a contact tonometer. Then we have this non-contact tonometer, that is gas esthesiometer and non-contact esthesiometer, which measure the corneal sensitivity. Alright, then evaluation for the lid pathology. Lid pathologies should be evaluated normally with the help of slit lamps and by expressing the meibomian glands to check for any meibomitis. And the newer methods include meibography, right? So in this, it is a non-invasive test which uses the infrared light, and we can see the anatomy of the meibomian gland, and if there is any meibomian gland loss also we can see. So with the help of that, we can also grade the areas of loss with this meibography. So we have this LipiView systems, which includes meibography and other tests in it. LipiView 2 was one of the important ones, which includes this meibography as well as other important tests. So this was regarding the various tests we have for tear clearance, tear film stability. So this LipiView 2 has non-invasive TBUT with meibography, right? So that's why it is called LipiView. And we have the composition, osmolarity, biomarkers, the volume, right? So this was regarding the diagnosis of dry eye, the recent advances and all the things which we have discussed in this class. I hope you like this video. Please subscribe to my channel for such informational videos, because it takes a lot of time and effort to create such informational and in-depth concept for your exams. Thank you.